Assalamu alaikum. I'm Dr. Zohraida Kareem, and I'm going to take you through the topic on autism for the next couple of minutes. Before I jump into the topic itself, I'd like to remind you one very important statement, and that is acceptance is key. In today's world, when we hear the term autism, it's like a taboo, a stigma, which shouldn't be. We're all different, we're all unique. We all have qualities which are on the positive side, but we all have flaws that we still need to work upon. No one is perfect. So, talking about autism, what is autism? Before I start talking about it, please do not start thinking that you have autism or your child has autism, because a lot of the signs we all have, but that doesn't mean we're all autistic, right? So, the autism spectrum disorder, which is called ASD, is a developmental disability caused by differences in the brain. And people with ASD often have problems with social communication, interaction. They have different ways of moving, of thinking, of understanding, their way of reasoning. They have lots of differences. And it is sadly the fastest growing disorder amongst children. And research now shows that 1 in every 36 children have autism. Now, the next question that would come to mind is what causes autism? There is not one specific reason that causes autism, or not one specific situation that causes autism in a child. But research does show that genetic disorders or biological disorders or environmental forces or influences do cause autism. Autism is a lifelong non-progressive disorder which typically appears in children before the age of 3. A lot of us, when we see our children with certain symptoms that don't seem common to us, the first question, or rather the first reason that comes to our mind is, I think my child is autistic. Because we hear so much about it and we don't know enough about it, for us everything right now seems like autism or ADHD. What are the symptoms we usually look for in young children? Usually, they don't respond to their name, they don't make eye contact, they don't smile when you smile at them, they usually keep repeating phrases or words that they hear, they tend to walk around in circles, they'll make certain weird sounds abruptly, out of context completely, they wouldn't talk as much as other children, they might even have speech delay, they behave differently. They will have meltdowns where all of a sudden they're okay and the next minute they're crying without any reason again. And they do not enjoy pretend play, which is something all children like doing. For the older children, it's much more different, and they usually don't understand feelings. They don't understand how other people feel. They are not able to express themselves. Their level of echolalia is much more higher, which means they keep repeating words and phrases. Certain sounds are triggers for them, certain food tastes are trigger, certain kinds of smells, fragrances also trigger them. They are more prone to having meltdowns where they would just want to sit down, throw a fit and cry. Also, they would have the repetitive movements such as flapping their hands or clicking their fingers or tapping the table. Unexpected things at unexpected times. They would rock their body back and forth, or they would fidget and squirm in their chair. Attention deficiency, they would not be able to focus. So with the older children, it's much more easier to pinpoint these symptoms, but with younger children, it's a little bit of a challenge. However, I always advise this to people asking me, when you feel that your child is autistic and if you see some alarming symptoms, what we call red flags, do not start predicting. The best way is to seek help, and the best way to identify this is to meet someone who is a professional with autism, who has years of experience, and they would do an extensive test, which is usually a 2-hour test, and the most common one used right now is CARS-2, and the doctor or the expert spends 2 hours with the child evaluating, doing different activities, doing different kinds of talking, discussion. And within those 2 hours, the child starts getting comfortable with the assessor. They start communicating to a certain level. And during the process, the expert usually has a sheet and they're making notes, they have checkpoints. And those are the things then guide us forward as to what level, if the child is autistic or not, and if they are, at what level, what therapy, what they need, what they require, and then the counseling sessions start for the parents as well. So there's a long way to go before you can actually say that a child, I don't like using the word label, but before you label or term your child as autistic, there's a lot that needs to be done. We want to help these children, not make things even more difficult. And that's why I started with acceptance is key. If we accept that the child, our child, has autism, you've already won half the battle. It's the other 50% now that you need to adapt to, and things that you will need to practice at home to make it easy for your child. And the same thing would be have to practice at school as well to make the journey much more easier for the child. So, how do we help autistic children? What are the therapies and activities that would actually help these autistic children? There are many. So that's the good news. You're not constricted, you're not constrained. And the advantage or the good news again is that Dar es Salaam has also started developing so much in the field of autism that I personally know 4 or 5 centers that were specifically designed for autistic children by parents who really struggle to get the right treatment and the right therapy for their child. And out of the passion of wanting to help their child, they studied, they did their research, they visited multiple countries, came back with knowledge, came back with expertise, and opened up these centers, hiring professionals to further help children. There's so many therapies out there, and not only for the child, for the parent as well. It's a heavy journey, but parents also need therapy in order to accept the journey ahead for them. But during the journey, please don't forget yourself. When you look after yourself, there's a healthy you, there's a healthy child and a happy child. A lot of times what these children need is one-on-one attention, not only at schools, but at home as well. You need to understand that the child is different. What may work for you and me definitely is not going to work for the autistic child. So what are the do's? What are the things you should do for an autistic child? Use your child's name when you're speaking to them. Don't just blurt out instructions without naming the child, because they will not realize you're talking to them, even if they're the only person, that is the only person in the room. Address your child with their name. Another thing, keep language very simple and very clear. I know we're used to giving out so many instructions at once. That's how I think we're trained, that's how we're brought up, that's how life is, that's what is demanded from us. But for such children, instructions need to be very simple and very clear. Use simple gestures, eye contact and pictures or simple symbols to support what you're saying. They make very less eye contact, but because they're used to having you in their environment, they're used to your voice, they know they need to connect with you. They will look at you, but not long enough. They will look at you very briefly, say your instructions, say what you want to, use body language, use your hands, but don't move your hands too fast. Again, too much of movement distracts them. They get traumatized, they get frustrated, they will just turn away and either start shouting, moving, or walking away. So you need to adapt to your child's level of understanding, the level of autism, precise and clear gestures. Sometimes cards really work as well. They may not understand your words. We all think in pictures. If I say the word elephant right now, you've probably seen the elephant in your mind and not the spelling, or you haven't heard the word in your mind. For such children as well, flashcards really help. So if you want to teach the child a new word, just pick up the flashcard which has, let's say, an apple on it and show it to them and say, apple, apple. Repeat yourself. And if you want the child to follow instructions and to bring the apple from the kitchen, say, apple from the kitchen. They will understand. So these are therapies you need to learn to help the child, and all this is very much available. You can even get these things offhand from the internet now. So what are the things you don't want to do? The first thing you should not do is ask your child a lot of questions or give your child a lot of instructions. So how was your day at school? What did you enjoy? What did you eat? Did you play anything? Did your friends enjoy with you? Were you upset about anything? These are the most common questions you hear parents asking their children. I need time to register the question. I need to process the question and answer. But if you ask children, normal children, 4 or 5 questions that go, you've lost them. Autistic children are very special. Special, even more special than you and I. So we need to break things down. We need to ask them things slowly. We need to understand things slowly from them. Another thing that you should not do not have a conversation with autistic children in a crowded, noisy place. Already they're struggling because of the level of noise. Already they're struggling because they are in a public place where it's not their comfort zone. They are feeling out of place. And then you're trying to have a conversation with them. It's extremely overwhelming. Another thing you should not be doing, which is a very common thing for us. You know how we say, hey, pull up your socks. You can do much better. Or best of luck, break a leg. Do not use terms that have 2 meanings. For us, pull up your socks means do better. For them, pull up your socks is literally sitting down, pulling up their socks because they think maybe their sock has rolled off. I started with one sentence and I will end with it as well. Acceptance is key. When you've made peace with the fact that your child is autistic, you have won half the battle. With that, I take leave and thank you so much for listening.